Hi, my name is Fereshteh Salimi-Jazi. I am a pediatric surgery research fellow at Dr. Don's lab. I'm honored to present our study on validation of GI motility patch measurements with simultaneous internal electrodes in a porcine model. The peristaltic activity of GI system is a complex coordinated series of contractions to mix and prepare enteric contents. GI motility disorder is defined as abnormal movement behavior of GI tract that affects its function due to dysregulation of GI myoelectric activity. Patient presents with various symptoms, including chronic abdominal pain, bloating, nausea, constipation, or diarrhea. Understanding the pathophysiology of GI motility disorders is complicated due to the complex interaction between interstitial cells of Cajal, smooth muscle cells, nervous system, neurotransmitters, and hormones involved in GI motility. The gap of knowledge impedes the development of effective therapies to improve GI motility. Neurostimulants have shown promising results, but for them to be effective, researchers must have reliable, accurate means of measurement. Currently, there are limited means to assess GI motility continuously in a non-invasive and objective way. Our group previously introduced the wireless skin patch measurement system to detect myoelectric signals of GI tract. The aim of this study is to determine the correlation between external patch measurements and internally measured myoelectric signals to define their accuracy. Myoelectric activity is the electrical current that the smooth muscle cells in the GI tract generate. Like the electrocardiogram of heart, a signal of the activity can be detected at the skin surface. The wireless skin patch myoelectric measurement system consists of disposable wireless pads that are applied on the skin. Each patch comprises 4 pairs of bipolar electrodes in 2 vertical and 2 horizontal pairs that continuously record the myoelectric activity of GI tract and transmit the data to a paired iPod. Designated application on the iPod collects the data and relays it to a cloud server. Data are downloaded and processed to represent organ-specific waves across the GI system. For this study, 4 female minipigs were used. Initially, 3 linear arrays of subdural strip electrodes were sutured to the stomach, small intestine, and colon serosa. The 8 individual elements of each electrode were configured as 4 bipolar pairs of signals for each organ. Wires were externalized from abdominal wall, and the signals were collected by a wireless data acquisition receptor. After placement of internal electrodes and incision closure, 4 external skin patches were placed on the abdominal wall to record and transfer the data to the same data acquisition system. Pigs were fed with solid food postoperatively, and data were collected simultaneously and continuously from both systems for the next 6 days. Data analysis included removal of large amplitude artifacts and Fourier transformation to create a spectra in 10-minute intervals on each internal and external channel. 10-minute section of the raw data for a stomach was recorded by internal electrodes and external patches are shown in the poster. Although internal electrodes had significantly higher signal strengths compared to external measurements due to the attenuation of the signal while traveling to the skin surface, both measurements showed similar reject signals at the same primary frequency as shown in the OL lab diagram. The frequency spectrum of signals for internal electrodes were similar to the corresponding spectrum from the external patch measurements for the same 1-hour period. The stomach had the dominant frequency that ranged from 4 to 4.5 CPM. Small intestine signals had their primary energy in the 12 to 15 CPM range, and colon signals primarily displayed a dominant broad peak in the 4 to 6 CPM region. As expected, The internal data has a more precise structure, including higher frequency components. External signals were not always present when an internal signal was measured, as the sensitivity is naturally much greater when the electrodes is in the direct contact of the organ. Our results demonstrate a clear congruence between external and internal measurements. External skin patch detect a substantial fraction of myoelectric activities measured directly by the internal electrodes on the serosa. Based on our data, external patch could potentially be used to help diagnosis of GI motility disorders and assess the effectiveness of GI stimulation modalities. Thank you for your attention.